Welcome back to Made to Be Whole. This week, we're talking to pharmacist Janice Marciniak about the benefits of hormone replacement therapy. Stay tuned.
Made to Be Whole is intended for informational purposes only. It's not intended to replace the advice or care of a licensed healthcare professional. Participating in this podcast does not constitute a provider-patient relationship with Krista Michener, AHP Integrative Health, or any of the guests featured on Made to Be Whole. Krista Michener, AHP Integrative Health, and any featured guests aren't responsible for any losses, damages, or liabilities that may arise from use of information obtained in this podcast or associated materials. Please consult a healthcare professional for any health-related concerns that you are experiencing.
Welcome to this week's episode. We're really happy today to have Janice Marciniak, who's a pharmacist at the Medicine Center here in Northeast Ohio. She got her pharmacy degree from the University of Toledo. She says long enough ago that pharmacy looked a lot different than it does today, which is true. I still remember, side note, like being a little girl. First of all, most people didn't take medicines long term, and if you had a refill, you like took your bottle in and they filled that bottle and you waited at the counter. It just kind of makes me feel a little old, but that's okay. She's been at the Medicine Center since 2006, and it's there that she was introduced to compounding and compounded hormone therapy. She said she's loved being a traditional pharmacist and a compounding pharmacist, but in the healthcare climate of the last several years, compounding is where she feels she can best serve patients. And she's become especially interested in BHRT, which is Bioidentical Hormone Replacement Therapy, and has completed specialized training in this area, attending 4 in-person specialized symposiums and several virtual trainings to keep her skills up. So welcome, Janice.
Hi.
So if you can give a little reminder, I know we covered when Brad was on the show, but for people who may not have heard that episode, tell us again what a compounding pharmacist is and how that differs from just your traditional brick and mortar retail pharmacy.
Compounding pharmacist is making something from scratch and making it exactly for you, exactly how your prescriber wants it to be. It's kind of interesting because for hundreds of years, maybe thousands, pharmacy was compounding. And you talked about when you were a little girl and when I was also, and started my pharmacy career, traditional pharmacy, you brought the bottle in, the pharmacist put some pills in it that a big drug maker made, and you went home. Hopefully it worked well.
Right.
Compounding is wonderful. It's kind of come full circle, and we're back to compounding again, which is kind of like making a cake from scratch. You get exactly what you want versus walking into the bakery and buying one and hoping that it tastes good. So that's the analogy I like to use. I would say with the technology and things we have today, I sometimes worry that people have this picture of like they've seen a chemist in a movie concocting something behind a counter in a bowl. No, it's much more modern technology, sterile, all that good stuff.
Cool. I'm just curious, when you went to pharmacy school, did they even talk about compounding or introduce you to that idea as a potential part of your career, or was it all just the retail prefab stuff?
It was all retail prefab, and I was the last class that had to take a class called pharmacognosy, which was basically medicine that came from plant material.
Okay.
And they decided that that was old fashioned. We didn't need to know that anymore. And so nobody after me took that.
Okay. Which is where all medicine started, interestingly. That's interesting. So what did you think when you were first introduced to compounding?
I had heard of it a couple times before I came to work here, and it sounded a little fantasy, make-believe, to be perfectly honest, because for so many years, I was somewhat brainwashed by drug manufacturers,
Sure.
if you will. And then when I got here and really saw it in practice, it really kind of blew my mind. So many things I didn't know about it, about how well it works, especially.
Well, and then I think just the idea that you're caring for an individual and you can really do something for their quality of
Yes.
life, whether it be because of allergens or dose. I mean, there's just so many cool things that healthcare in general has trended toward being not
Yes.
individualized at all. And
Yeah.
you get to be in the sandbox where you get to actually play and do the things that can help the person in front of you.
They do have a good story.
Yeah.
You had mentioned, buying the cake with all the bad stuff in it that you don't want. And I have a patient, she has mast cell disease and has many allergens. She can't even take Benadryl, for instance, which you take when you're allergic to things.
Right.
But she would have trouble with that. We have to compound just about everything that she makes with a very inert powder, just so she can take her basic medications, her heart medications and things. And she's one of our most interesting patients
Sure.
and somebody we've done a lot for.
What are some clues for you that they might be reacting to the fillers or those inner ingredients versus the actual drug?
Very often the common allergy reactions that people have, they get hives, they might just get headaches. Those really are the most common.
But if it's, so I guess, for example, like that person, how did you know that, or how did she figure out that process of, wait, it's not this heart medicine, it's all the garbage that's in it that's making me sick? Because I have patients who I know
Yes.
it's more the fillers that are bothering them, but everybody just says, well, I'm allergic to. Like, how do you help people figure out what's worth trying as a compound?
With her, in fact, I mean, it was many years for her. I think the first thing that people start noticing is that no matter what medication they're being prescribed and no matter what it's for, they don't feel helped at all. If it's an anti-inflammatory like ibuprofen, it's just not really working. I still hurt, things still don't feel right. So it's just that kind of initial feeling, and no matter what I try, nothing does what it's supposed to do. So that's really the first sign.
Well, and I don't think people realize too how even with your traditional pharmaceuticals, once you get into the world of generics, that all generics aren't the same. As far as the percent of the active ingredient,
Yes.
the fillers, things like that, you're not getting,
Yes.
it's not what they say it is. It's not.
Yeah.
So
Yeah.
the two questions, if we could dive into a little with hormone replacement therapy, or I guess we'll break it down into three questions. First of all, the benefits of hormone replacement therapy, the difference between regular HRT and what you specialize in, bioidentical hormone replacement therapy, and then dispelling some of the myths or concerns about safety. So just starting off, if you just wanted to tell someone, simple language, what are the potential benefits of hormone replacement therapy as far as quality of life?
I break it down into two things. And the first thing absolutely is quality of life. Most people on hormone therapy are women who've gone through menopause. There are uses for younger women, but mostly menopause. And, are you living with hot flashes and night sweats and thinning hair and no sex drive and feeling blah in 15 different ways? Hormone therapy is going to make you feel better. It's going to give you a better life. And the second thing is to help prevent disease. We did not used to live as long as we do today.
Yep.
And yeah. And we're not living well. One of the seminars I was at, one of the funniest things I learned is that there are only 4 species of whales and humans who live past menopause. I don't know how the whales are feeling, but I know that it's not going well for women at all.
Well, it's interesting because I hadn't thought of that before. I've heard some people say, oh, women have dealt with menopause for years, but actually not really. I mean, for a long time, our lifespan was so limited, and this excuse we give people, well, you're just getting older, you're just getting older, but you could live 40 plus years post menopause and deal with aches and pains that are not necessary. You know, there's obvious wear and tear that happens if you're around the planet long enough, but avoidable suffering seems like a big deal. So if we were to just do a quick summary of progesterone, estrogen, testosterone, what are some of the symptoms of like someone possibly benefiting from progesterone replacement if the progesterone levels are low?
Progesterone helps improve your sleep. It helps maintain bladder function. It helps you build bone, which is especially important as we get older. If you're on estrogen, you should be on progesterone. Progesterone also helps balance that estrogen. And we're going to get to it a little later, but like you said, a lot of people are afraid of estrogen. Progesterone is one way that you balance that and make that okay. Estrogen is just one of the most amazing things ever created in the universe. It has well over 40, probably 50, 60, 70 functions in our body. We have estrogen receptors everywhere in our body. Estrogen helps, for instance, decrease your LDL and increase your HDL. It helps prevent cardiac disease. It helps you maintain your bone density. So that goes for the osteoporosis, and it helps keep your cognitive function. So to me, those are kind of the big three as we age. We want to prevent those. And being on hormone therapy does that. Some people like to say, well, you know, you're just getting old. I like to say you're not getting old because you're losing your hormones. You're losing your hormones because you got old.
Right.
So we have to put them back because you're still here with us and make all these things okay.
Sure. And the whole point of bioidenticals is you're just replacing something that was in your body for a very long time. It's not a foreign substance, you know, it's more like a vitamin deficiency almost. And I think the cognitive piece, a lot of people aren't aware of, you know, they think hormone replacement, well, big deal if you have hot flashes and vaginal dryness. First of all, the person who says that is probably a man who's never had them. But those things aside, cognition is a big, big deal. And if you look at dementia risk, if there's something we can do to offset that, that's pretty tremendous. And then for men need estrogen too, but correct me if I'm wrong, testosterone is the precursor for that. If we get their testosterone high enough, they're usually going to be able to make adequate estrogen for their needs.
Correct. You're absolutely right. And you bring up a good point. Both men and women need estrogen, progesterone, testosterone in different amounts, of course, but when they're in balance, that whole symphony is playing the right way.
Right.
Yeah.
And if you think about, I don't remember who said this, but I heard someone call progesterone once nature's Xanax, which I thought was funny, but for some people, just replacing progesterone is super calming. And you mentioned sleep. I mean, how many people struggle with insomnia? I think some people are really hesitant, if you could speak to this, about dose, because we don't want to start people higher than we need. We want to work them up. But that doesn't mean it's necessarily bad to get to a semi-high dose if that's what a person's body needs. Is there any risk of, you know, taking, well, first of all, I guess, how do you determine what's too much? Because I think arbitrarily we look at numbers on the dose versus how a person responds. Is there a milligram formula that's too much, or do you go more by symptoms and labs?
I love a lot of things you said there, and we are trying to get people away from that arbitrary, I took a hormone level, you need this much. It should very much be, if you want to start on hormone therapy, the first thing you do is get your hormone levels done. But the second thing you do is talk with your practitioner. There are really good questionnaires that detail a lot of symptoms. You go through that, you know, this is bothering me, this isn't. And you take those two things together, and that's where you start. And you always start low. Thank you so much for saying that. We want to start low. We want to do that. We want to test you again in a couple months, see where your levels are, see how you're feeling. You're probably going to start feeling better within a couple of weeks, but it's going to take some fine tuning. So I say 3 to 6 months later, get tested again, have that same conversation, and then add a year. And by then, you've usually fine-tuned what that person needs. And you might only have to test yearly after that. Some women do only need progesterone, and they'll be just fine. Some need all 3 plus 2 or 3 more. It's so individual. It has to be looked at that way. And you raise the dose very slowly. If you look at the numbers of the amount of estrogen or progesterone a woman makes, we don't want to go too much higher than that. We don't want what they call supraphysiological doses.
Right.
You know, like people mega dosing vitamin C, for instance. Do not do that with hormones.
Right.
More is not better.
Right. Well, and I think you brought up a really important thing about process and the patience that it takes, because people want fast results, and they'll say, well, I don't think it's helping, so what else do you have for me? Versus giving it time, just like we talked about with Brad and the LDN. This is a process. Let's let your body adjust and see how it responds. And you're definitely in better shape if you don't wait to do these things until you're like not functioning. Not that it can't help you then, but prevention is a big deal.
It is. And it's been shown if you start hormone therapy within 5 years of menopause, 10 years, maybe at the latest, you get the best preventive effect that we were talking about with the heart disease and the cognitive decline. But also, as you said, that doesn't mean you can't start anytime. You can start to feel better anytime in your life.
So what is then the difference between just hormone replacement therapy generally and the bioidentical hormone replacement therapy that you specialize in?
What we specialize in and make are the actual hormones, like you said, that our bodies make. The same estrogen molecule, the same testosterone molecule. It's like a key in a lock, if you will. The synthetic hormones from a long time ago, people might remember Premarin. Unfortunately, it's still out there. When you take those, I like that analogy of the key in the lock. The key might go in the lock, might slide right in, but it doesn't turn. So it kind of works, but it doesn't do everything it's supposed to. And because it doesn't work the way it's supposed to, it causes side effects too. And when you take bioidentical hormones, the same thing, as you said, that we are making, that we're supplementing in your body, that key goes in, that door opens wide open, and things are good. So it's very important. Drug manufacturers do make some bioidentical products, estradiol and progesterone. They're okay, but a couple things that they have problems with, there are limited doses and dosage forms. So the dose they make better be the one that works for you, or you're not going to get great results.
Right.
And they have a lot more fillers and things, as we said. When we compound, we use the least amount of fillers that we need to. Yeah.
And then also fillers that people aren't going to respond to. It just blows my mind again that progesterone, which is bioidentical, is commercially available in a peanut oil emulsion. Like what planet are we on that we decided that was
what is a
good idea?
A more common allergy in this country than
that's a story for another day. So talk a little bit about testosterone and its benefits for men and women. Men, I think people are more aware, oh, my testosterone, I'm tired, I'm weak, cognition, those sorts of things. But what are some of the benefits that women might not be aware of that having their testosterone optimized can help with?
Yeah, you are right for men, and they do tend to be a little bit easier to diagnose and cure and make feel better. For women, it does a lot of the same things. We just have to be more careful with it. It is really important. It does increase our muscle mass and our muscle tone. And as a person ages, that is something that really starts to degrade, losing muscle and getting weaker. You can see it in the walk. of some people. Just watch older people walk. Some just look feeble and they look small and others look healthy. And I promise you, the ones that are speed walking down the street have a good testosterone level.
Right. You think along with that, I just keep thinking of all of the complications of aging that just with hormones we could potentially prevent in at least a portion of the population, because you're looking at osteoporosis with that weakness. Think about falls. I mean, if you're
Yes.
deconditioned and weak and you fall, hip fractures, like what's the morbidity and mortality associated with that? And that dementia. I mean, this is really low hanging fruit for people, but it's so demonized. I don't, it's really, really, it's really unfortunate. That would be a whole philosophical discussion on its own. Now, one of the reasons that some people come back and say you can't do this, they have safety concerns because of some kind of flawed studies that were published a couple of decades ago and some misinformation. Can you speak to the safety of hormone replacement, especially estrogen or estradiol in women?
Yeah, sadly, a lot of people are afraid of hormone therapy. And it was from some bad hormone therapy in the 90s and the early 2000s. And there were 2 studies that came out and said that it causes heart attacks and cancer. Sadly, the opposite is true. Estrogen done right, bioidentically, helps prevent heart disease and helps prevent the senility and the osteoporosis we were talking about. But the fear that created was big. It was taught to everyone in medical school at that time for 10 or 15 years and probably still today. But it's old and it's outdated. Those drugs were not bioidentical. They were very different. One was horse estrogen. Horse estrogen shouldn't work well in a human. Works great in horses. So
generally speaking, my understanding with estrogen, there's even a higher safety profile if you're doing creams, patches, like the transdermal application. Is that correct?
That is absolutely correct. If you are going to go on estradiol therapy, it should be topical. When you rub it onto your skin, it gets absorbed into your body. You'd be amazed how quickly and easily that happens. And it gets metabolized a different way. And you don't get that same cancer risk that people are afraid of. You also don't get that clot risk. Anybody who's been on birth control pills has heard that. Don't smoke. It can cause blood clots. The same is true with oral estrogen. You really should never take it orally. That should always be topical.
Could you address along those lines? Because when we were talking before just about synthetic hormones in general and the risks, we have a generation or 2 of women who have been fed synthetic hormones for decades for contraception. What are some of the potential health risks of oral contraceptives?
Unfortunately, the 3 things we've been talking about, and also breast cancer. It pains me to say that birth control freed women in a way, and it's a wonderful, but very sadly, it does have that risk. And if you take them for a few years or 30 years, you've increased your risk of breast cancer. Unfortunately, I don't have a great alternative.
That's the big concern. I mean, I've thought so much about this, how women are just trapped because I think part of what drives not having alternatives is these are so lucrative. I mean, they're coming out with new formulations of oral contraceptives all the time. They are a massive moneymaker. So what is the motivation if you have something that people believe are safe and effective, but if you've got that pipeline, there's just no motivation from a, I guess, financial perspective to look at alternatives. And it's funny because I remember when I was in my childbearing years saying something about stopping the pill because of mood problems. And my OB, who was fantastic, I mean, he was actually really, really good. He goes, we don't hear that very often. I thought, well, you don't talk to many women then. I mean, because I guess if they stop taking it, they don't come back. But how can you say, I'm taking these synthetic hormones that are supposed to trick my body into thinking I'm pregnant, but it's not going to do anything negative for my mood at all. Like nothing. It just doesn't add up at all. But it's an interesting conundrum that people are in, that you don't have safe other contraceptive measures that are super convenient, reliable, all of those things.
Yeah. And somehow I feel like they have tied that to the other end also. They're taught to give you Prozac when you go through menopause.
Right.
I might not be feeling great, but my depression may not be organic and need Prozac. It might just need estradiol and progesterone.
I saw something really funny. I subscribed to this list where they send you pictures and medical cases and say, what's the diagnosis? And there was imaging of this person with this massive tumor on the back of their head. And that had foreign objects in it. It was really odd. But one of the respondents said, well, it depends. Is it a man or a woman? Because if it's a woman, it's definitely anxiety. But if it's a man, ... I thought, wow, and she was just being tongue in cheek, because we've heard that so much from our patients and the people we help. If the medical system can't figure out that it's the patient's fault.
Yeah. And we are still fighting that today. Please advocate for yourself. Please, if you're told you're just getting old, please come and find people like me and Krista and talk to us. There is help. Things have changed. There are safe, healthy ways to age.
Sure. And I think with testosterone, the safety myth around that one, it hasn't always been a controlled substance, but then it got grouped in categorically with people who are abusing anabolic steroids. And this is just so different. Man, you're not going to turn your spouse or yourself into a raging... I mean, if they're already a jerk, it's not going to change that. But no, if it's responsibly dosed and you're watching levels, like you said, strength, cognition. I remember reading once, and I apologize, I can't give you the source, but a man who had been in a nursing home for end-of-life care was started on testosterone replacement, moved back into the community, lived and died at home, was independent, because that was the issue. And that's why he was weak and frail and not able to remember things and care for himself. It's not always that simple that it's one thing, but I think it's a good testament to the idea that, if there's a missing ingredient, I say this for nutrients a lot. You can't make good chocolate chip cookies without enough chocolate chips. Then you can't age well without your hormones being balanced. So as far as insurance coverage, when you have something made especially for you, the 99% of the time, your insurance is not going to pay for it, but it's okay. You're worth it. If you're able to do it at all, just know this is something, if you can have increased longevity, decreased falls, your cognition is better. I mean, how much farther ahead are you financially if you're able to make that investment? And also, I like to tell people, think about what's fair. We get programmed into these, like, what a $5 drug, this, that, or the other. Like, what should Janice be paid for standing back there formulating something specifically for your body? And do you want the ingredients coming from like some garage on Amazon? If you want quality ingredients and personalized care, we want to pay people fairly for that. We want to make sure we're getting what our bodies need. Is there anyone who it is actually absolutely contraindicated to do hormone replacement therapy?
I would say women who have had breast cancer, especially if it's the hormone positive breast cancer, that's a very dicey place to be. It can be done, but it takes an expert. And I will admit I am not expert enough to do that. So that is the one group of people that I would say no. Do
you have any parting words of wisdom about hormone replacement therapy? So you're at the Medicine Center, you guys are in Ohio, and you can mail to anywhere in Ohio. If somebody is not in Ohio, what's the best way to find a compounding pharmacy that can help them with bioidentical hormones?
You can still call us if you'd like. We are members of PCCA, the Professional Compounding Centers of America. It's where we buy most of our chemicals and things from. But they are a nationwide company, and they have a wonderful find a compounder. So we have often said, well, what's your zip code? And I'll plug it in and say, okay, I found, 8 pharmacies within 50 miles of you, and these 2 are accredited. And so I know they're good and that they do things the right way. And, here you go.
Sure. Well, and I would say too, in reverse, if you can't find a provider who is willing to test your hormones, go talk to a compounding pharmacist, because they can tell you who writes prescriptions and sends them there.
Yes.
Because I have had a lot of people say, well, I've asked to have my hormones checked, but they refused to do it.
We can do that for you. We can do salivary testing here at the pharmacy. You can come in and get it. And so depending on your provider, there are some absolutely afraid they won't touch this. Like I talked about earlier, I talked to one yesterday. And then there are some who want to help their patient but don't know what to do. So they will take a recommendation from me. And then there are wonderful providers like you.
I'm like you in that I was given the line in school, unsafe, this, that, or the other. So the reason people are hesitant is they're doing what they were taught in school. And you just have to be willing to learn more, because we all paid a lot of money and went into a lot of debt to get taught some things that just aren't true. And that's a very uncomfortable position to be in. But that's all right. And I will give a plug too, for younger people with really severe fatigue, anxiety, it's worth checking too. Even though menopause is a bigger period of time, I have some younger women who have really benefited from progesterone. And I have some younger men whose testosterone is shockingly low. So even though we're looking mostly at the end of the lifespan, if you've got a lot of chronic stuff, cognitively, emotionally, energy-wise, I think hormones are always worth taking a look at. My son, who's 26, out of desperation, I checked his because he hates blood draws. And so I'm like, well, I can do a saliva test and see if I'm missing anything. And his testosterone was half of that of my 50-year-old husband's, who was not exceptionally high. And this hates shots, but it's changed his life. I mean, he feels when it wears off.
It is happening more and more to younger people. You're absolutely right. And if you are afraid of syringes, we can get you some cream to smear on.
Creams are fantastic. Thank you very much for joining us, Janice. I've learned some things. I really appreciate it. I think it's something that we can't talk enough about, especially because most people are trying to do what's best for their body, but there's a lot of misinformation, and just understanding where that comes from. There are people you can talk to. We're not trying to turn you into something you're not. I love the key and the key that turns. You're looking for the key that turns so that you can reverse some things, but then even better, prevent. All right. Well, thank you, Janice. Thank you for tuning in, and remember to have hope, because you were made to be whole.
Have a podcast question or suggestion? Text or call us on the podcast info line at 330-439-0686. Thank you for spending time with me today. If you like what you hear, please subscribe to be notified when new episodes release. And remember, you were made to be whole.